sense. Oh, there is something on our inside that's telling us, just go on, brother.
When COVID first hit Croydon, it brought so much fear in the black community.
There are things that are not equal. They're not fair either. If you feel that things are unequal, you're less likely to trust some of the information that you're given.
He will.
It's not really much of a stretch for people to mistrust the government. And that sort of trust needs to be re-earned.
I said, how people?
The situation with the vaccines, what do you think about it?
If they call it COVID, yeah, there's something like that. Virus always exists.
There are people who are non-takers, people who will take it, and you're in the category of, I don't know why I'm taking for something if I'm not sick.
That is correct.
But this is about prevention.
And how am I going to help it from preventing it from happening?
Well, people are being infected, but there again, if you don't believe it exists, so what do you think it is? Is it flu, a bad cold, or what?
It's hard to say because we heard, over the period of time, we've heard all these figures of people being sick with COVID. And in my surrounding, I can't pinpoint anyone who has COVID or been sick from COVID in that way. I've been sick during the same period of COVID, and as I said, it's a normal cold, and I took cold medicine. I didn't go to see a doctor, and I'm back as normal.
I didn't get up and plan to be a mythbuster, but just by being seen as something quite credible and being a credible source of information, it's really humbling. As a pastor here, there are people sending you things, please look at this, please pray for me, I'm really worried about this, I'm scared, because people can't work out whether it's true or not. Fake news is a real problem. This video was probably one of the earliest ones I saw way back in March, and it's still doing the rounds. And I wonder sometimes if people are sending it because they want to appear to be clever and part of the crowd, but not realizing that actually the virus that you're spreading is the virus of fake news and misinformation. And that's as equally as dangerous, I think, as the COVID virus.
Hallelujah. Good morning, folks, and it's such a great pleasure to have you all here. From Croydon this morning, we're going to pray for the nation. Praise House has a congregation of about 100 people from different nationalities. We thought that it would be quite interesting to bring 4 leaders from the Together Croydon churches this morning to talk about their perception on the COVID vaccines. As a leader, one way that I can help my people overcome their fears and concerns is by me actually going forward to take the vaccine.
One of the things I think is really important, we've got to take into consideration the issue of trust and the lack thereof, in so much as if we think in more recent history, the issue of Windrush and what happened with a couple of previous governments in that they created that hostile environment.
My nephew at 25 decided that he wanted to get a British passport. He was born in the UK, never left the UK, suddenly found he could be deported to a country that he was not born in, never been there, and purely because one of my sisters had not applied for naturalisation, although she'd been here nearly 50 years. So mistrust, yeah.
I'm more likely to win over my congregation to support the whole vaccination process than somebody who doesn't look like them coming to talk to them. They'll switch off. my own family, we are divided. Those who want to take it and those who don't want to take it. But we respect one another.
It's so hard to know what to do because you're hearing so many things. You have to do that research yourself, but there's not enough information out yet.
I do have my reservations, and I'm not really sure whether you should go for it yet. We've been married for 31 years. I'm not ready to say au revoir yet. I don't want us to be used as a guinea pig, and when I say us, the communities that, you know, that they're kind of targeting right now.
Are you referring to like the black community?
Yeah. I think we need to have time to decide for ourselves when we should take the vaccine.
Views from some of the people at Croydon there. Well, earlier I spoke to London's Mayor Sadiq Khan, who is worried himself about mistrust in the vaccine.
We do know, I'm afraid, from speaking to Londoners, but also polling we've done, there are many Londoners who are hesitant about taking the vaccine, and that includes many black, Asian, minority ethnic Londoners. So the key thing we've got to do, in those of us in positions of power and responsibility who can influence people, we've got to persuade Londoners and those across the country about what a game changer this is and give Londoners the confidence to take the vaccine.
Would you offer to have a vaccine as soon as it becomes available?
Absolutely. I mean, when it's my time to have the vaccine, I will take it willingly. And
Would you do that tomorrow if you were offered it tomorrow?
I would, but here's the conundrum. I'm always nervous about jumping any queues. The reality is this: if you're a black Londoner, your confidence in institutions, your confidence in the state has been diminished by the government's actions over the last few months and years.
What's your message to them right now?
I understand your concern and unhappiness with the government. I understand you don't trust this government, but I've done my research. I'm confident this vaccine is safe. I'm confident that it wouldn't have been given the green light had it been safe. I'll be encouraging my mum, and has underlying health conditions, to have it as soon as she's eligible to do so. And if it's good enough for my mum, it's good enough for anybody.
But give us a sense of the incentive to have the vaccine, the proportion of people who will need to have it, in your view, before London can start getting back to normal.
Do you know, over the course of the last few days, I've learned that more than 7,000 Londoners have now died. And many of them may have not lost their lives had they had immunity because of a vaccination. You having a vaccine means that you won't catch the virus, but also you could potentially stop passing the virus on to somebody else who is vulnerable. I genuinely think this is a game changer.
And are you confident that the prioritisation of the vaccine is the right one, elderly first, care home workers and so on? Or would you like to see BAME people who are more likely to get seriously ill given some priority?
And the government's got to consider the black, Asian, minority ethnic community as well as those Londoners who are in jobs where they could catch the virus in a way that others don't.
So put them to the top of the queue along the queue.
I think we've got to have that conversation, and I think different parts of the country may well have different priorities. And it's really important the government works with different regional leaders for them to explain what the areas are like.
Sadiq Khan, thank you very much.